Welcome back to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today, and just about every third Monday of each month. This week is National EMS Week 2013, so today we are discussing the Monterey County Emergency Medical Services System. Joining us for our third and final segment is Mr. Rich Harrison, a paramedic with American Medical Response, Monterey County. Welcome, Rich, and thank you so much for taking the time to talk to me today.
Thank you. I'm happy to be here.
Great. So, like I asked Kirk, how and why did you become a paramedic?
Well, I first got exposed to EMS at a very young age. I swam in high school, and at 15, I became a lifeguard. It was the natural choice for my summer job. I got some advanced first aid training, some training in oxygen administration, emergency childbirth, automated defibrillation, things like that. And I was pretty much hooked. I did go off to UC Davis, where I earned my bachelor's degree, but shortly thereafter I decided I was going to pursue my dream, and I took an EMT course at Outdoor Adventures at UC Davis, and after working for a little while I went back to school at Foothill College, where I became a paramedic.
Wonderful. So what's a typical day like for you as a paramedic?
One of my favorite things about this job is that every day has the potential to be so different. We could be invited into someone's home at a very difficult time in their life and see very private moments and private places in their life. Or we might see the sun come up on the wilds of Monterey County. Or we could get assigned a transfer, I think, as Mr. Schmidt mentioned, anywhere in the state of California, really, or even beyond. We could be finding ourselves going to San Francisco or Sacramento or down to San Diego or Los Angeles.
So it's a job that definitely, it's different every day.
Absolutely.
It keeps you interested, and you can go anywhere and do it.
That's my favorite part about it.
Okay. So about how many calls per day do you get, and what's that like? Like, when someone calls 911, they're not calling you. So what does it call mean, and like about how many do you get a day?
Well, the number of calls varies greatly, and we really, being human beings, we hope that no one ever needs our services.
Right.
But we know that people will need us. And about twice in my career, I've had what we call a no-hitter, where we haven't had any calls. But those days are obviously few and far between. We usually run anywhere from 3 calls on a very slow day to maybe 12 calls on a very, very busy day.
And an 8-hour shift?
No, our shifts are all 12 or 24 hours.
Ooh.
We don't have an 8-hour shift.
Ooh, 24.
Right. The only actually place that I know of in the United States that has 8-hour shifts is Hawaii. So, yeah.
Why is that? No one's getting in no one has an emergency situation? It's too nice?
No, I don't think so. Maybe they just need the time off to go surfing.
Okay, gotcha. And so what kind of calls do you get most often, or what kind of calls do you get in general?
Pretty much any type of call that you can imagine. I mean, we run, basically any sort of exacerbation of chronic medical problems that people have, whether it's related to hypertension. The big ones I think Mr. Schmidt mentioned were stroke and heart attack. Also, that's obviously an exacerbation of, chronic conditions like atherosclerosis. Then we deal with respiratory emergencies a lot and problems with diabetes a lot.
Okay.
Then, another big thing we do is we respond to traumatic injuries. So it could be, a drowning at Monterey Beach. It could be a tour bus that rolls over in Soledad. It could really be anything.
Yeah. A shark attack.
Rattlesnake bite up on Mount Toro.
Oh.
Yeah.
Wow. So how do you know where to take people, especially if they can't communicate with you?
Well, I think Mr. Schmidt mentioned that we have an extensive set of protocol and policy that
Indeed.
guides us. And that's really important that we have that, because in the heat of the moment that we're trying to provide care for someone, we all need to be on the same page about where that person needs to receive their care. And I think he also mentioned specialty centers. So we have specialty centers for STEMI, for heart attack. We have specialty centers for stroke. And I think the EMS agency is working right now on a plan for a trauma center here. But we definitely have access to those trauma centers through the air ambulances that respond into Monterey County. So we can request a helicopter and fly someone out if they have a traumatic injury. Yeah.
So it has nothing to do with, I want to go here, I have insurance, I don't have insurance. It totally depends on their ailment, or?
If a person is identified as maybe being a subacute patient, maybe they're not having a very serious emergency, we certainly want to give them the opportunity to make their wishes known. And part of our responsibility to all of our patients is continuity of care. So we do like to see them go to the providers who are most familiar with them. So if they, for example, if they're out here on Highway 68 between CHOMP and SVMH, and they say, I want to go to CHOMP, that's where my doctor is. If there's not a specific reason that we need to take them to SVMH, then we'll do our best to make sure that they get to go to the hospital if they're choosing.
That's cool.
Yeah.
So what are some of the life-saving procedures that happen inside the ambulance?
Well, most people have seen CPR being done, at least on TV. But what a lot of folks don't realize is that an ambulance is really a mobile intensive care unit. We have a state-of-the-art monitor defibrillator that allows us to perform 12-lead electrocardiograms, to defibrillate people, to cardiovert them, to pace them transcutaneously. It's basically an external pacemaker. And then we carry about 20 different drugs that we can use to treat anything from nausea to heart attack to pain from broken bones. So we have a lot of great tools at our disposal. We can manage someone's airway with something as basic as oxygen and positioning, or we can do something as invasive as endotracheal intubation, putting a tube into someone's trachea and breathing for them with a manual ventilator.
So there's no surgeries going, there's no open nothing going on in there?
So the most invasive skills that we perform in the state of California are cricothyrotomy and thoracentesis, and those skills are done at the paramedic level with needles, with rather large needles, probably about that large. And those would be used to do things like provide a path for the air if we were unable to access the airway from above. So for example, if someone was missing most of their face, we might be able to breathe for them through a tube that we put into their neck here with a large needle. And then we could relieve pressure built up between their lung and chest wall with the other procedure I described by putting another large needle here. Now, we really hope, like I said, we're human, we hope that we don't have to perform those skills. If we're performing those skills, someone's having a really bad day.
Got it. On a lighter note, I'm assuming you have the antidote to like a rattlesnake poison or something, or?
Anti-venom is actually something that is scarce, and it has to be taken care of in a very specific way. I believe it has to be refrigerated.
Temperature.
So usually it's only hospitals that carry that. So if someone gets bit by a rattlesnake, we'll make sure that they get to a hospital that has the anti-venom, but we'll call around often to make sure that we're taking them to the right place.
Okay. Very interesting. Thank you. So what, in your opinion, are some of the biggest strengths of our EMS system in Monterey County?
Well, I'd have to say the people. We are people who are doing this job because we want to provide compassionate and competent care, and we've gone through an excellent training and selection process. We have our own like bar examination, board certification equivalent. We call it the National Registry.
Oh.
And it's what's called a computer adaptive test. So as you go through the test on the computer, as you answer the questions correctly, they become harder and harder. And there's really no way to trick it or share answers or anything like that. So after that, every EMT and paramedic in the state of California has their fingerprints sent to the Department of Justice and the FBI.
Okay.
So they have to be model citizens. And only after they've completed that whole process can we evaluate them and give them permission to practice in Monterey County.
Wow.
Yeah.
I feel very much more special by being here. That's I've heard about those tests. The CAT test, is that what? Yeah, that seems sort of daunting. So what are some of the biggest challenges though with our system in Monterey County?
Well, Monterey is geographically very large.
Oh.
If you look at it on a map and compare it to some of our neighboring counties, you'll see that it's almost 3 times the size of some of them. So sometimes the allocation of limited resources like ambulances can be a challenge, but I think it's a challenge that we meet day to day.
It sounds like it with 30 or so minutes from call to hospital.
Yeah.
Sounds like it's not a problem. Is there anything people can do in their lives or around their homes per se to keep themselves safe, prevent illness and injury, prevent having to have you come to their house?
Well, certainly it's pretty much everything that your mother and father told you to do when you were growing up. You know, drink only in moderation, don't smoke at all, always wear your seatbelt, always signal before you change lanes, look both ways before you cross the street, pick up any loose items off your floor.
Okay.
You know.
Some basic type stuff.
Basic things will really prevent more than 90% of the problems we encounter.
Wow. I think I should have listened a little bit more when I was younger. Is there anything else that you'd like to add, a message for our viewers? Anything?
Well, I had the privilege of watching both of Mr. Schmidt's segments, and I heard that he will be out there at the Natividad site with the fair that's going on there and all the first responder resources. If you can't make it out to Salinas, and it sounds like something you shouldn't miss, if you're stuck on the peninsula side, we are hosting a hands-only CPR demonstration at San Carlos Beach from 9 a.m. to 5 p.m. on the same day, on May 22nd. So,
okay.
But if it was up to me, I would prioritize visiting the helicopter and seeing all the other EMS vehicles out there.
Well, one could definitely do both, it sounds like.
Yeah, maybe.
Have a little EMS day.
Yeah.
So we have some time left, and a question that I was hoping that we would get to, but what is one or some or just a story or a nice moment that you have? Do you have anything like that to share?
I think some of my favorite moments have been seeing patients after they have been through the entire healthcare system. So we generally only see them up until the point that we hand them off to the emergency room physician. And having patients come up to me in a parking lot when the last time I saw them they were unconscious and very badly injured from a car accident, and just thanking me, or getting a letter from a patient that's been sent to my manager thanking me. Those are things that really kind of stick with me. and keep me in the game, I guess.
Yeah, it's very
Yeah.
rewarding, it sounds like.
It
And I
is.
understand now, too, why you responded the way you did when I asked you about the biggest strengths in Monterey County is the people.
Absolutely.
If they're all like you, then we're doing really well. So I think that's about all the time we're going to have for today. Rich, I want to thank you again for spending this time with us and really for doing what you do on an everyday basis to save people's lives and keep everyone safe and free from illness and injury. Thank you.
Thank you.
Yeah.